हेलो स्टूडेंट्स। आज डे 7 का क्वेश्चन था that there is a 25-year-old female who presented with a painless, firm 3 centimeter sized breast lump. Her lump was sampled by FNAC and later on she underwent lumpectomy. Two images were given to you. One was of a cytology preparation and the other was a histopath section. What is your most likely diagnosis? What are its variants? And what will be your closest DD? So, as you have guessed correctly, the correct answer is indeed fibroadenoma. Fibroadenoma, as we all know, it is a biphasic benign tumor which is composed of proliferation of both glandular as well as stromal components. It is the most common breast tumor of adolescent and young females, and it is the most common benign tumor of female breast. Although it can occur at any age, but the median age is 25 years. Juvenile fibroadenomas are seen in adolescent females, and complex fibroadenomas usually occur in older patients. So, it is the most common benign tumor of female breast. Clinically, it presents as a painless, well circumscribed, or well localized, smooth, firm swelling which is freely mobile. It slips under the examining finger, hence, it is known as breast mouse. Grossly, it is usually less than 3 centimeters in size. It is well circumscribed mass with a bosselated external surface, and on cut surface, the lobulations are visible and slit-like spaces are seen.
So students, this is an actual fibroadenoma lumpectomy specimen. You can see that the external surface is well circumscribed, smooth, ovoid mass with bosselated surface. The cut surface is also smooth, homogeneous, well circumscribed, and it also shows lobulations which are seen bulging above the cut surface. कट सरफेस में स्लिट लाइक स्पेसेस भी दिखती हैं, कभी कभी म्यूकॉइड या फाइब्रोटिक अपीयरेंस भी दिखता है, और जब कैल्सिफिकेशन प्रेजेंट रहता है तो वाइल कटिंग वी गेट अ ग्रिटी सेंसेशन. फाइब्रोएडिनोमास रेयरली 3 सेंटीमीटर्स के ऊपर रहते हैं. दे आर स्मॉल टिश्यू मासेस. सो दिस इज अ क्लासिकल हिस्टोलॉजिकल डिस्क्रिप्शन ऑफ अ फाइब्रोएडिनोमा.
Microscopically, we see both the epithelial and stromal components. The epithelial component is composed of ducts which are lined by a double layered epithelium, and the stromal component is made up of fibrous tissue. The epithelium is surrounded by myxoid stroma. When it is compressed and distorted by it, it is known as intracanalicular pattern, and when it is completely surrounded by the stroma, that is known as pericanalicular pattern. The intracanalicular pattern gives it the irregular slit-like spaces. So this is a picture of classical fibroadenoma in which we can see the compressed glands and proliferation of a myxoid stroma. On cytology preparation, we see tight cohesive clusters of ductal epithelial cells which are usually in a branched pattern, जिसको हम कहते हैं antler horn या stag horn pattern या फिर honeycomb pattern, honeycombed sheets of ductal epithelial cells. बहुत important रहता है इसमें that there are abundant bipolar or naked nuclei present, which is very important feature that it is a benign tumor and the myoepithelial cells are present abundantly in the background. Another important feature is that they are hormone responsive and they grow during pregnancy. The second part of the question was what are its variants. तो इसके वेरिएंट्स रहते हैं मिक्सॉइड फाइब्रोएडेनोमा, सेलुलर फाइब्रोएडेनोमा, कॉम्प्लेक्स फाइब्रोएडेनोमा और जुवेनाइल फाइब्रोएडेनोमा। फिर आपसे इसका एक क्लोज डिफरेंशियल पूछा गया था। सो द क्लोजेस्ट डिफरेंशियल टू अ फाइब्रोएडेनोमा इज अ phylloids tumor or a Phyllodes tumor. Lastly, let's talk about the triple test. Triple test is nowadays considered a gold standard test for diagnosis of fibroadenoma. It consists of three parts. The first is the physical examination or the clinical examination of the breast. Second is imaging either by mammography or by ultrasound. And third is fine needle aspiration cytology or core biopsy. So, together, the diagnostic sensitivity is increased if we consider all the three tests done together than either test alone. So, these are my references. Fibroadenoma is an important topic for your Viva, specimens, and even for MCQs. So, study it properly. Thank you so much.